Zoom room where we have Frank Mansell. He is from the Federal Emergency Management Agency. He actually has been on our show way back, kind of at the beginning of the pandemic. So it's good to see you and to catch up with you. Frank, how are you?
Off a day and happy holidays and Merry Christmas. Yes, I started so long ago I had hair at the time.
So you're back in California, is that right?
I am. I've been in California since the end of May and have had the opportunity to work in other disasters since then, but we're still keeping our finger on the pulse of what's going on in Guam. And we've had a team of IMAT specialists just depart the island today for the mainland. And we have two remaining staff who are dedicated to the affairs there right now.
So if you could, just give us an update on some of the programs and assistance, at least, to date that FEMA has assisted Guam with, because we haven't heard a lot.
Sure. One of the first things we started out with was pushing supplies, protective medical equipment, personal equipment. And to date, what we've done is we've provided N95 masks in the tune of 300,000 N95 masks, 4.4 million surgical masks, ventilators, 34, face shields, 188,000 face shields, coveralls and biohazard bags of 3,300. So we've continued to, or actually we're just about all done pushing that material to Guam, and that was our initial push, and that's where we're totaling out right now. There are a number of other, items that we've shipped, but that constitutes a bulk of it.
Right, and I think one of those items that was shipped were these federal medical stations, right? Whatever happened to
Yes.
those?
Well, we received two. We received them early on, and we had not used them by the time I had left in May. Still trying to track down if they were deployed and opened and used. But I believe that they may have. I'm going to have to call you back and let you know that. I've got to call into my person on the ground in Guam.
And if you could just go over what those FMSs are.
The FMS stands for Federal Medical Station, and it is a series of 48 large compartmentalized boxes, and they contain a cot, medical stands for IV units, and everything else that's needed for emergency care immediately. They're intended to be set up. They were deployed by the Department of Health and Human Services, Department of Public Health and Human Services, and we just transported them and stored them until needed.
Yeah, I remember talking about this pretty in depth several months ago when you first got here, and because there was the fear, right, that we would see just so many people getting infected. And I mean, here we are, 7,000 positive cases later.
Situation has certainly changed since I left. I believe when I left, there were 5 fatalities, and the trend was certainly on the downslope. But watching it climb now to well over 100 fatalities, and as you said, 7,000 cases, that's quite a shift. And it's, we have not left. We still have resources. We have people back in Oakland here that are actually processing what are called public assistance projects. To date, we've got 39 projects from Gov Guam that are being reviewed. We've put $13.7 million in awarded projects for 6 projects. So 6 projects totaling $13.7 million for things like PPE, security services, overtime services, and the conversion of the hospital from Guam Memorial Hospital to convert that and increase its ICU capacity. And so that's kind of one of the ways we're supporting the effort.
Mm-hmm. Did you say 39 projects? Still waiting?
39 are under review.
Mm-hmm. Can you tell us what those are?
No, I cannot off the top of my head. I know that I can tell you what we have awarded
Okay.
funds for. One was for $29,000 for the purchase of personal protective equipment and disinfecting supplies at non-congregate shelters. There was emergency protective measures in the form of $8,200 for security and traffic control at the Guam visitors area. And that's who it went to. I don't know the exact location.
Mm-hmm.
Emergency protective measures, $18,000 for staffing at quarantine sites. Medical supplies of $182,000 for essential government employees. And overtime for the Emergency Operations Center for those staff that were initially budgeted for. So if they were on staff before and required overtime, then we would pay for part of that overtime. And then $11.5 million to convert the Guam Memorial Hospital and make it ready for the increased number of staff or number of infected persons.
What? So I'm sorry. So FEMA awarded up to $11 million to the Guam Memorial Hospital
To temporarily convert it to an alternate care site.
I see. And again, 39 projects are still up for review.
Right.
Yes. And how much money are we talking with these 39 projects? Do you know?
Of the 39 that are outstanding, there's a total potential value of $18.9 million.
Do you think you could send me the list later?
I'll check, see what I can do for you.
All right. Thank you so much, Frank. So you're back in California. What's it like over there?
I just saw just before lunch the ICU bed capacity in Southern California has reached 100%, which means there are no ICU beds left, reporting out of Southern California. So it's everything is in lockdown here. The governor's, like a number of states, has initiated measures that are probably best in the long run to make sure that we contain things.
Mm-hmm.
Frank, at the beginning, you mentioned, kind of dealing with some other emergencies as well. I'm assuming you were referring to the wildfires. Where are we at with that?
Most of the wildfires are either extinguished or contained. I think the last wildfire outbreak occurred just outside of southeastern Los Angeles County and Orange County.
Mm-hmm.
That is contained, probably still burning a bit, but contained.
Mm-hmm.
But it's been a wildfire season for us. But we still keep an eye on what's happening with Guam. Just because one disaster hits doesn't mean that we don't finish the job on the other.
Is FEMA contributing to the vaccination distribution here on Guam?
No, that's all coordinated by the Department of Public Health and Social Services.
Mm-hmm.
So that, although another federal department, we don't have anything to do with that.
No, I just meant like with providing supplies or anything like that, or resources, funding.
Not that I'm aware of.
Okay, because public health did mention that they were working with FEMA regarding cold storage units.
Well, actually, that's true. That is what's called a mission assignment, and we are working on a mission assignment is a special project where we will go in with all federal resources that we can. And we are in fact looking at procuring the necessary freezers to maintain that vaccinations at the proper temperatures. So that's a top priority for us right now.
Okay. Any other priorities?
Nothing that comes to mind. I know that let me just look at the mission assignments that are out there. We have right now what are called telehealth internists, and that's where you would have access to medical treatment via the computer. And we've actually have retained some doctors to do that and contracted them up until the end of December. We've received a request for some cots for the Department of Corrections, and we're working on that through the mission assignment process. And as I said, we've also extended the Title 32 for the National Guard, which extends that to either mid-month or to the end of the month.
The National Guard,
Frank?
is that a 75% cost share, or what is that?
Yes, that is.
Okay. What was,
Frank, when your number gets called, are you going to get vaccinated?
Yeah, and I expect that will probably be in the summer. None of us are first responders, and like I say, I'll wait in line and hope for the warmer vaccine instead of the colder one.
Frank, real
I
quickly,
hate, so I could wait till September as far as I'm concerned.
Frank, could you tell me a little bit more about the mission assignment you were talking about for DOC? I didn't get that. Did you say pods?
No, the Department of Defense. These are the these are the telehealth folks. The Department of Corrections is who we're providing COTS for. So there's a request for that. COTS, C-O-T-S.
Mm-hmm. What are the cots for?
I have
Sabrina,
that up.
to sleep on.
No, I mean, duh.
Thank you. I'll find out more about that for you. I apologize for not having that at my fingertips. That would be a resource that I'll have to call on.
All right. Thanks a lot, Frank, for coming on and giving us an update.
Yes, and like I say, I'd just like to wish you the best and ask that, of course, all the residents of Guam good health and that they're pay attention to their social distancing and their isolation and their quarantines. I'm so sorry that the numbers have escalated the way they have. It's, having been on the island so long, I have a little bit of kinship with that, although not the way you do. So anyway, thank you very much for inviting me on.
All right. Merry Christmas.
Merry Christmas.
Merry Christmas.
Have a day.
Again, that was Frank Mansell with the Federal Emergency Management Agency. Just catching up with him. It's been a while since he has been on the show. The last time was, 7, 8